Should there be a market in body parts? My name is Dignalisa Reynoso, and my answer is yes. History of organ transplantation. Dr. Joseph E. Murray performed the first successful kidney transplant in 1954. Only 30 years later, and hearts, pancreas, liver, heart-lung transplants were already being done. The most historic discovery came in the mid-1970s with the discovery of cyclosporin, which suppresses the immune system so the body doesn't reject a new organ. Issues with successful transplantation. In 1996, about 4,000 people died waiting for a new organ. According to UNO, the United Network of Organ Sharing, which is responsible for locating donors and recipients, stated that by 1999 there were a little over 60,000 people waiting for an organ. There is a shortage of donors because of religion purposes, family unwillingness to donate from their deceased family members, and uncertainty on the process of transplanting. Laws pertaining to organ transplant. The 1984 law passed by the National Organ Transplant Act in the United States made it illegal to purchase or sell organs. People who were caught breaking this law were subject to fines and incarceration. This law was implemented to prevent the wealthy from being at an advantage to move up on the waiting list because they had more money to pay for it. Is organ transplantation a good idea? Humans can live a normal life with one kidney, which reduces the harm for the donor. As the recipient, for example, waiting for a kidney transplant means not having properly working kidneys and therefore needing dialysis. A person waiting for an organ should be able to ask freely to the public for a donation. For example, maybe going to a school or going to where you work and saying if somebody is willing to donate their kidneys. Dialysis is limited for some patients and almost non-existing in developing countries, which means that people will die from needing a kidney. Donors who are poor can sell their organs of their deceased loved ones for bills or other expenses. Arguments with organ transplantation. The poor will be more likely to donate organs without thinking of the consequences because they are desperate for money. A way to prevent the less fortunate from being underpaid would be to create a legal system to give donors proper care before and after the donation. Another argument is that the wealthy will be at a better advantage for receiving an organ because they have more money. A solution for this would be creating an organization that will be in charge of fair donation and receiving. Organ transplant based on utilitarianism. Utilitarianism is an ethical theory that states that a person's actions should be based on maximizing the greatest happiness for as much people. Organ donation from a living person will create happiness for both the one donating, because they're doing something good, and the one receiving it. If the person is deceased, the family can benefit from the profit of the donation, and the person receiving the organ will be able to live a better life. Organ transplantation based on Aristotle's virtual ethics. Virtual ethics is the idea that a person lives a life following the moral virtues. Some of the moral virtues, according to Aristotle, are courage, generosity, fairness, and amongst other things. A person donating an organ would have to let go of any fears or worries and would have to trust the doctors and the process of donating. Having an organization to facilitate the donation process should act with fairness so that the person gets paid properly. Final comment. I say yes to organ donation because some people are in need of money, and donating an organ that is not going to compromise the donor's health will help them financially. Also, the family might want to donate the organs of the deceased person to cover certain costs, for example, the funeral costs, or to help pay with the mortgage. This will also help the recipient get another chance at living a healthy lifestyle.